Hi everyone, welcome to our 12th episode, which is going to be all about AI in medicine. I'm Shanti.
I'm Ellen.
I'm Serena.
And I'm Sharvi.
So basically, AI has made a huge progress in medicine, such as things like diagnostics, data analysis, and even precision medicine. And it's already being applied to areas from patient triages to even cancer detections. Specifically, AI language models like ChatGPT pass the SUMLE, which is the United States Medical Licensing Examination, and basically a 3-step examination program for medical licensures in the U.S. ChatGPT can also solve internal medicine case files, but in real life and in the near future, physicians will be able to use medical-grade AI for consultations using prompts such as provide advice on the diagnosis and treatment for these symptoms, create a personalized treatment plan based on the patient's age and lifestyle, analyze this X-ray to detect abnormalities, identify risk factors from the patient's EHR, and lastly, write a letter explaining the medical necessity of this treatment, which these prompts were provided by Harvard Medical School, an article about AI in medicine. But the biggest speculation is that AI will replace some medical jobs such as dermatologists, radiologists, or even pathologists, which are what people would assume are easier to take over by AI. But in reality, it is unlikely that AI will replace these jobs anytime soon. This is because AI lacks empathy, compassion, complex decision-making, and also critical thinking, which are all very, very valuable elements in providing patient care in the medical field. Some research even proves patients would rather hear news from doctors instead of AI. But at the end of the day, there are many pros about AI, and the biggest one is that it can facilitate scientific discoveries and breakthroughs in disease prevention through data analytics. Serena, do you want to talk more about the differences?
Yeah, sure. So for everything, there's always pros and cons. And some of the pros for AI in healthcare are that AI can analyze medical data much faster than humans, which could lead to more patients being seen. And it helps doctors catch diseases earlier and more accurately. It reduces paperwork so doctors can spend more time with patients. It improves personalized treatment plans, and it lowers healthcare costs in the long run because we don't have to pay the actual doctors. And then some of the cons are that AI can make mistakes if it's trained on biased or incorrect data. Patient privacy and data security are also major concerns because AI will use the data it gets from one patient to help the other. And too much reliance on AI could weaken human judgment. Technology is expensive and not available everywhere, so only the people that are rich would be able to access this kind of technology, and patients may feel uncomfortable treated by machines. And there are actually some kinds of AI that are being tested or used right now already, and some of them include like AI doctor patient listening tools, which my doctor actually uses herself. It's like this app on her phone, and it listens to our conversations, and it translates it into like a document that she can look back on. And it automatically, these kinds of apps automatically record conversations and turn them into medical notes, which allows doctors to spend more time talking to the patients instead of typing on computers, which I think is really great. And there are also AI medical imaging systems that analyze X-rays, MRIs, and CT scans to detect diseases. You can also use AI in drug discovery to find new treatment for things. And there's also robotic surgery, but that one is still being in the works. It's still being tested. And there's also virtual AI health assistants. Shanti, would you like to add more? Or Sharvi?
Yeah. So there's also a really high chance, just like Serena said, of AI physician collaboration. So AI may match or exceed physicians in small diagnostic tasks like radiology or pathology or dermatology. And evidence actually suggests that physicians and AI collaboration, it outperforms either alone. So most likely in the future, we'll probably see more physician and AI collaboration than just AI acting alone or a doctor being alone too.
So adding on, AI is also used in robotics, specifically in like hospitals and in surgeries. And some robots that are used in hospitals are like the Moxie robot, which you've probably heard of it or seen it. And it has like social intelligence that enables it to greet patients. So it provides a more comforting environment. And there's also many other types of robots. But one specific system is the Da Vinci surgical system, which basically is a robot-assisted platform that enables surgeons to perform complex, minimally invasive procedures with greater precision. And how it works is a surgeon sits at a console and it views a magnified 3D image of the surgical site on the patient while controlling the robotic arms of the robot. And then there's a patient side cart that has 3 to 4 robotic arms, and it holds instruments like scalpels or scissors, and also has a camera. And so the system interprets what the surgeon is doing by the surgeon does hand movements with their fingers and their wrists, and the system interprets this, and then it scales this down for a delicate task in the body. And the whole purpose is that it's a laparoscopic surgery, which is minimally invasive and just better for your body. Another system is the STAR system, which stands for Smart Tissue Autonomous Robot, and it performs soft tissue procedures. And similarly to the Da Vinci surgical system, it has greater precision than human surgeons. Another way that it uses AI is through deep learning, because it uses AI to plan tasks and then precisely executes these plans, allowing it to recover from errors. And similar to the other system, it is also a laparoscopic surgery, which means that it's minimally invasive and also better for your body. Sharvi, do you want to add on?
Yeah. I just want to talk about all this different ways that AI can be used specifically in different diseases. So, for example, cardiovascular disease. So AI systems can interpret ECGs to identify arrhythmias, and they can also predict risk of heart failure and detect subtle abnormalities linked to stroke or cardiac events, because AI looks for patterns, and there are a lot of patterns in your heartbeat. Also, new AI enabled stethoscopes, they combine sound and ECG data to detect heart conditions like heart failure and valve disease within seconds, so it improves early diagnosis. Also, machine learning models can stratify risk, and then they can also support prognostic predictions in conditions like hypertrophic cardiomyopathy and congenital heart disease. Also, AI can be used in neurological diseases. So AI-powered monitoring devices, they track motor systems like tremors for diseases like Parkinson's and sclerosis. And so they also help diagnosis and to track progression. And then, like I believe Ellen mentioned, they can also be used for cancer. So AI supports histopathology and molecular diagnostics by analyzing images of like biopsy images and genomic data, so it can distinguish the cancer types and then guide treatment decisions. It can also tell people the likelihood of them having cancer or cancer reoccurrence. And then there's also predictive models and disease risks. So large-scale models can predict someone's susceptibility to over 1,000 diseases. And then AI can also identify individuals who are at high risk for conditions like diabetes or sepsis.
Thank you for listening to our 12th episode of The Doctor's Discoveries. I'm Ellen.
I'm Serena.
I'm Sharvi.
And I'm Shanti. Just a quick disclaimer, this podcast was researched and produced by high school students, so not everything will be entirely correct. Thank you for listening. Bye.